This project started because we had a culture here that believed that a fracture clinic should be like an airport.
They were experiencing undue backlog of patients in the waiting rooms, as the physicians were ordering the patients all to come to the hospital at the same time. So everybody arrived at 8 o'clock in the morning, all 85 or 90 patients.
And there were bottlenecks at central registration, there were bottlenecks at DI, and then patients waited in our waiting room for 3 to 4 hours to see the doctor.
First thing we did on the scheduling side is we made what was called a protocol appointment. What happens when a patient comes to central registration now is they get checked into one half of the appointment, and that appointment fires the order over for the x-ray to DI. The patient is then rerouted to DI directly. Don't come to AmCare first, they go to DI, get their x-ray done, then they come back to AmCare where they're checked into AmCare. And then they can have their clinical follow-up. The second piece that we added was the introduction of a tracking board for the orthotech. The orthotech now is able to see that the patient has arrived at the hospital, can see if they're going to DI first and then coming to AmCare, or whether they're going to come straight to AmCare, and can see when they're actually checked into AmCare. So what we've done is reworked the electronic scheduling system, which would allow them to book appointments in 5-minute blocks. Those 5-minute blocks then allow us to space out the patients adequately so that not everybody comes at 8 o'clock in the morning anymore. You know, now they come at 10:15 if their appointment's at 10:30. So we've streamlined the patient flow tremendously. And most of the feedback we were getting from the old system, patients didn't like it. They just despised sitting waiting for 4 hours because they were told to be here at 8 o'clock.
By changing the schedule and having only 3 patients every 15 minutes, we were able to change these wait times from 3 to 4 hours down to an hour and a half. Still lots of work to do, but certainly a good improvement.
I think it's been a tremendous success, and I give full credit to Martin Balch and his team for the overhaul that they've done, because it's worked very well.
So one of our strategic goals in our newest plan is to create positive patient experiences, and certainly this project is really helping us to do some really good solid work towards that. We've engaged a group of patients, former patients and volunteers who've had experience with our oncology program, and got them to come and help us with designing and improving our oncology patient experience.
As you're sitting there and either observing it or walking through the process, some things that we may improve, that we may do better, that we might be more supportive of, ways that we can make a challenging experience for the person the best experience it can possibly be.
From decreasing waiting times to improving patient education and looking at the physical space. We've just moved to a brand new area. Our patients had some input in how it's designed and how the flow occurs when they come to see their physician or their nurse that day.
For many people, it's so foreboding to get that diagnosis, even if it's a good bad diagnosis, because sometimes it's very curable. I think by doing certain things, certainly in the educational end of things, we're helping that patient to be able to address their illness and helping them to learn to understand that this process need not be as daunting as they may expect.
We now have a wonderful binder that's covered many topics, and it is easy to see, and it gives people access to things when they want them, as opposed to trying to access when people are initially diagnosed. Perhaps they're not ready to deal with everything that's going on, so if they need social work later, they need dietitian later, they know where to go and get that.
And I think until you live with experience of having cancer, you don't know what these people have gone through, so how powerful it is for us to learn from them about what it's like to live with cancer and how we can do those things to make this experience better for them.